Hey guys, my name is Ronald Solimto. I'm a registered nurse and also a family nurse practitioner. Welcome to my channel, Nurse Track 101, where nursing concepts are made easy just for you. Well, let's get started. Come on, guys.
Hello guys, welcome to Nurse Track 101, and this is your host, Ronald Solimto. And today we're going to talk about the different types of questions in NCLEX. So without further ado, let's get started. The first type of question that you're going to encounter in NCLEX is the questions about prioritizing. In this kind of question, you want to look at for keywords that will indicate the need to prioritize. Also, in this kind of question, all options may be correct. And what you need to do is to determine the correct order of nursing actions. So some strategies to use in this type of question is the use of ABCs, which is airway, breathing, and circulation. Also, Maslow's hierarchy of needs. And the third one is the nursing process. We're going to look at a few examples on different type of this questions. If you look at this question, a client with a diagnosis of cancer is receiving morphine sulfate for pain. The nurse should employ which priority action in the care of the client? Number 1, monitor stools. Number 2, encourage fluid intake. 3, monitor urine output. Or 4, encourage the client to cough and deep breathe. So in this kind of questions, you want to use the ABCs, which is the airway, breathing, circulation, as a guide to select the answer. And look at the strategic word or keyword, which is priority. So monitor stools is not really a priority. Encourage fluid intake, yeah, it's a priority, but it's not as important as you see at number 4, which is encourage the client to cough and deep breathe. Monitor urine output as well is not a priority. It's not as important as number 4. Deep breathing is really important because morphine sulfate can cause respiratory depression. So you want to encourage the patient to cough and deep breathe. You want to choose number 4 because this is the correct option that addresses airway. ABCs, airway, breathing, and circulation. Okay, let's look at this other question. The nurse caring for a client experiencing dystocia determines that the priority is which action? Number 1, position changes and providing comfort measures. Number 2, explanations to family members about what is happening to the client. 3, monitoring for changes in the physical condition of the mother and fetus. And number 4, reinforcement of breathing techniques learned in a childbirth preparatory classes. So, as you know, dystocia means difficult birth. And all the options actually seem correct. They're correct and will be implemented during the care of this client. But look at the keyword, which is priority, and use Maslow's hierarchy of needs theory to prioritize. And remember that in Maslow's hierarchy of needs theory, physiological needs come first. So the correct answer will be number 3, which is monitoring changes in the physical condition of the mother and fetus. And all the other ones, like number 1, for example, position changes and providing comfort measure, is important, but it's not as important as number 3. Number 2, explanation to family members about what is happening, probably to alleviate anxiety, but that's up in the hierarchy. And number 4, reinforcement of breathing technique learned in childbirth preparatory classes. It is important as well. This is about education, but that's going to come later on. Okay, let's look at different question about nursing process. The nurse developing a plan of care for a client with a cataract understands that which problem is the priority. So this is a question about priority again, and the nurse is developing a plan of care. So this is about nursing planning. Nursing planning and what is the priority in this plan of care. So if you look at the answers for this. Number one, concern about the loss of eyesight. So this is about concern about this is about client's anxiety status. Number two, altered vision due to opacity of the ocular lens. This is about the physical status of the eye after cataract surgery. Number three, difficulty moving around because of the need for glasses. And number four, becoming lonely because of decreased community immersion. So the correct answer is number two, because this is about the physical or physiological need at that moment. The second type of question that you're going to encounter is question on therapeutic communication. So it is important in this type of question, you want to focus on the client's feelings, the client concern, the client's fear, anxiety. Focus on those things. Let's look at an example of this type of question. A client's schedule for bowel surgery states to the nurse, I am not sure if I should have the surgery. Which response by the nurse is appropriate? Number one, it's your decision. Number two, don't worry, everything will be fine. Number three, why don't you want to have the surgery? And number four, tell me what concerns you have about the surgery. Remember to use therapeutic communication technique to answer this question. Number one, it doesn't really answer the question. It's kind of blunt. It's a blunt response and does not address the client's concern. Number two, don't worry, everything will be fine. Well, this is a false reassurance. Option three, you can't really use why, and you know this. In therapeutic communication, using the word why, the client might feel defensive, and this is not a therapeutic communication. So the correct answer will be 4, which is tell me what concerns you have about the surgery, because it will help the client to verbalize his or her feeling about the surgery. So the third kind of question in NCLEX is the kind of question that will ask you to determine if an abnormality exists. So in this kind of question, a scenario will be presented and you will determine if there's any abnormality in this scenario. And if you determine that an abnormality exists, a further assessment or evaluation will be needed. And if there are options like continue, monitor, or document, then don't choose these options. They are always wrong. Okay, let's look at one example for this kind of question. The nurse is caring for a client being admitted to the emergency department with a chief complaint of anorexia, nausea, and vomiting. The nurse asked the client about the home medications being taken. The nurse would be most concerned if the client stated that which medication was being taken at home. Number 1, digoxin. Number 2, Quinapril. Number 3, losartan. Number 4, furosemide. So note the keyword also here, most. The first step in approaching the answer to this question is to determine if an abnormality exists. So the client is complaining of anorexia, nausea, and vomiting. Therefore, an abnormality does exist. And if you know your pharmacology, and you have to know your pharmacology, that anorexia, nausea, vomiting, these are signs and symptoms of digoxin toxicity. So this will be the hallmark of digoxin toxicity. So the correct answer will be number 1. What I want to focus at in this kind of question is to focus on whether there's an abnormality in the scenario. And in this case, there is. The fourth type of question that you can encounter in NCLEX is questions that have close-ended words. Close-ended words such as never, always, none, every, must, only. Usually, if you find this word in the options presented, usually they are wrong, they are incorrect. So eliminate the options that have these words. Answers that have open-ended words such as usually, maybe, may, generally, commonly, this may indicate the right answers. So if you look at this particular example, a client is to undergo a computed tomography scan or CT scan of the abdomen with oral contrast, and the nurse provides pre-procedure instructions. The nurse instructs the client to take which action in the pre-procedure period? Number 1, avoid eating or drinking after midnight before the test. Number 2, limit self to only 2 cigarettes on the morning of the test. Number 3, have a clear liquid breakfast only on the morning of the test. And number 4, take all routine medication with a glass of water on the morning of the test. Note the close-ended words only in option number 2 and 3, and number 4 has the close-ended words all. So if you eliminate these options 2, 3, and 4, and you will have number 1 as the right answer. So remember to eliminate options that contain close-ended words such as none, never, only, always, every, and must. These answers are typically or usually incorrect. So the next one is questions that contain umbrella options. The umbrella option is the one that is broad and universal statement and usually contains the concepts of all the other options. Usually the umbrella option will be the correct answer. Okay, let's look at another example. A client admitted to the hospital is diagnosed with urethritis caused by chlamydial infection. The nurse should implement which precaution to prevent contraction of the infection during care? Number 1, enteric precaution. Number 2, contact precautions. Number 3, standard precautions. And number 4, wearing gloves and a mask. So focus on the client's diagnosis and recall that infection is usually sexually transmitted disease, so STD or STI as it's called right now. Also note that the correct option is the umbrella option. Remember to look for the umbrella option. In this case, the standard precautions. Umbrella option is a broad or universal option that includes the concepts of the other options in it. In this case, standard precaution can cover wearing gloves and a mask, can cover contact precaution, and can cover enteric precautions. So number 3 is the right answer. The next type of question is the kind of question that asks you to delegate a particular assignment. In this type of question, you want to determine what assignment is being delegated and consider client's need and match the client's need with the scope of practice of the healthcare provider that is identified in the question. So you have UAP, which is unlicensed assistive personnel such as nursing aide or CNA, and then you have LPN, which is licensed practical nurse. In general, non-invasive interventions such as skincare, range of motion exercise, ambulation can be performed by the UAP. And the LPN or licensed practical nurse can do what the UAP does, but also can include interventions such as catheterization, oral medication, subcutaneous medication, dressing change, suctioning, all those assignments. Okay, let's look at example of this type of question. If you look at this question, the nurse in charge of a long-term care facility is planning the client assignments for the day. Which client should be assigned to the unlicensed assistive personnel? In this case, it's like a CNA or nursing aide. Number 1, a client on strict bed rest. Number 2, a client with dyspnea who is receiving oxygen therapy. Number 3, a client scheduled for transfer to the hospital for surgery. Number 4, a client with a gastrostomy tube who requires tube feeding every 4 hours. Note the subject of the question, the assignment to be delegated to the UAP. So when asked questions about delegation, think about the role description and scope of practice of the employee and the needs of the client. So in this case, a client with dyspnea, for example, who is receiving oxygen therapy, a client scheduled for transfer to the hospital for surgery, and a client with a gastrostomy tube who requires tube feedings every 4 hours. All these clients have both physiological and psychosocial needs that require care by a licensed nurse. So the UAP has been trained to care for a client on bed rest. And in this case, the correct answer will be number 1. So remember, to match the client's needs with the scope of practice of the healthcare provider. The next type of question is the question about pharmacology. Well, there's no easy way to answer pharmacology question, but by learning about all these medications. Three important points for this type of question. The first one is usually in this type of question, the medication will be presented in their generic name. So it's important to know the generic names of the medication. Number two is it's important also to remember about the classification of this medication. For example, beta blocker, ending name for the beta blocker is LOL, LOL. For ACE inhibitors, it will be Pril, like captopril, lisinopril, stuff like that. And number three, it's important also to know the question being asked, such as the intended effect of the medication, the adverse effects of the medication, the side effect, and also the toxic effects of the medication. Okay, let's look at an example of this type of question. Quinapril hydrochloride is prescribed as an adjunctive therapy in the treatment of heart failure. After administering the first dose, the nurse should monitor which item as the priority. So look at the keyword for this one and focus on the name of the medication. The keyword will be priority. The name of the medication is Quinapril hydrochloride. Remember that this medication ends with pril, so this is an ACE inhibitor. ACE inhibitor is a type of medication for hypertension. So the priority for this one is to look at for blood pressure. The nurse should monitor the blood pressure, which is the intended effect for this medication. The blood pressure should go down. So the correct answer will be number 4. The last type of question in NCLEX will be questions that have comparable or alike options or answers. In multiple choice question, you're going to see options or answers that are alike or comparable. You can eliminate them because they are usually wrong. Let's look at one example of this type of question. The nurse is caring for a group of clients. On review of the client's medical records, the nurse determines that which client is at risk for excess fluid volume. Number 1, the client taking diuretics. Number 2, the client with an ileostomy. Number 3, the client with kidney disease. And number 4, the client undergoing gastrointestinal suctioning. Focus on the subject. The client is at risk for excess fluid volume. And think about the pathophysiology associated with each condition. And the only client who retains fluid is the client with kidney problem. And as you can see, the client taking diuretics, like option number 1, the client with an ileostomy, option number 2, and the client undergoing gastrointestinal suctioning, all of them lose fluid. So these options are comparable or alike. And remember, you're going to eliminate them. So the correct answer will be number 3, which is the client with kidney disease. Okay guys, so these are the types of questions you're going to encounter in NCLEX, and I hope this will be beneficial for you, and I'll see you guys next time. Bye.